If you are on Social Security or disability benefits, listen up. I have your April 2025 Social Security retirement SSDI and SSI payment schedule. When is your check going to hit your bank account? I have the details for you. And there's been a lot of questions about President Trump's plan for seniors. What is the president planning to do in 2025 to improve the lives of seniors? I have 10 proposals that is being discussed in Congress. I'll bring it to you soon. Now, if you're not familiar with us, we are Benefits Insider. We have been creating content over 15 years, helping seniors get the benefits that they deserve. So if you're new here, hit the like button, hit the subscribe button, because we appreciate your support. And finally, just as always, I like to know where you're watching our broadcast from. So go into the comments and let me know your city and your state. So let's dive in. There are two topics I want to cover with you today. The first one is the Social Security payment schedule. I have the list for you. Checks worth up to $5,108 are headed out soon. Who is going to get them? Now, the maximum benefit is for those who have paid the maximum into the system. So if you've waited until age 70 and 2025 is your full retirement year, then you are going to get the maximum. Now, if you retired at your FRA in 2025, then the full benefit you can get, the maximum, if you've paid everything that is required into the system, is $4,018 in 2025. And your full retirement age may be 67 or 66 and change, depending on when you were born. But most people retire early. About 30% of seniors retire at age 62 to collect Social Security benefits. So the maximum benefit at 62 is $2,710 a month. And the overall average, if you take all the money people are receiving in Social Security and you strike the average, it's $1,925 as of November 2024. Obviously, a big change that is happening this year is that the full retirement age is going up again. In 2025, it is going to be 66 and 10 months if you are retiring this year and you're claiming benefits at your full retirement age, at which point you are entitled to the full benefits that you have earned. And if you contributed the maximum into the Social Security system, then you're going to get that $4,018. Next year, the full retirement age is going to move again by another 2 months to age 67. So let's talk about your payment schedule. Well, as you may know already, if you're on Social Security retirement benefits or SSDI, which is Social Security Disability Insurance, your payment schedule is based on your birth date. If your birthday falls between the 1st of the month and the 10th, you get your benefits on the second Wednesday of the month. If your birthday falls between the 11th and the 20th, your benefits are deposited on the third Wednesday. And if your birthday is between the 21st and the 31st, your Social Security or SSDI benefits are deposited on the fourth Wednesday. If you're on SSI, which is Supplemental Security Income, you get your benefits on the first of the month unless the first is a holiday or a weekend. And then there's a whole group of people that get their benefits on the third. They include those who live outside the US. If you receive both Social Security and SSI, if your state pays for your Medicare premiums, and if you file for Social Security before 1997, that group of people get their benefits on the third, unless the third is a holiday or a weekend. So for April 2025, here is your payment schedule for Social Security retirement benefits and Social Security disability insurance. If your birthday is between the 1st and the 10th, you're going to be paid on April 9th. If your birthday is between the 11th and the 20th, you're going to be paid on April 16th. And if your birthday is between the 21st and the end of the month, you are going to get your Social Security or SSDI check on April the 23rd. If you're on SSI, your benefits will come in on April the 1st, which is a Tuesday. And since it's not a holiday, your benefits will come in on time. And then those who receive their benefits on April the 3rd, your benefits are also going to come in on time on Thursday, April the 3rd. So if you live outside the US, you're getting both SSI and Social Security. Your state pays for your Medicare premium, and you file for Social Security before 1997. All those group of people get their benefits on the 3rd. And this month or next month is going to be Thursday, April the 3rd. Now, if you don't get your benefits or your benefits have been stopped, you need to wait at least 3 business days, because that is how long it takes to clear any banking issues that's holding your benefits. But if after 3 business days, your Social Security or disability benefits still haven't hit your account, there is a big problem. And it's likely you are one of the 2 million people that are hit each year with Social Security overpayment, which means that they are stopping your payment and are using the money to pay back all the money that you owe in overpayment until it is all paid off. So if you want to know why your Social Security benefits have not come in, call Social Security. You may be required to schedule an appointment to visit a local office and get ahead of what's going on and why your benefits have been withheld. Now, we've been talking a lot about President Trump and what he plans to do for seniors. A lot of seniors know about the no tax on Social Security part, but what else is in front of the president? What are they discussing? There's a lot of budget discussion that's happening. What is the president planning that is going to benefit the financial well-being of seniors? I have 10 proposals that the president and congressional Republicans are looking at that I want to share with you. So what President Trump can do for seniors? Well, here are 10 ideas before the president. So the first one, before we get into it, let's look at seniors in general and why they are important to the president. President Trump has promised not to cut Social Security or Medicare benefits. He has repeatedly stated his administration will protect programs vital to seniors' financial security and healthcare. Older Americans represent 27% of the electorate, almost a third, while 57% voted for Trump in the 2024 election. So seniors, by a slight majority, voted for President Trump. This significant voting bloc helped secure his return to the White House. Many seniors are facing financial challenges due to inflation, with some delaying retirement and other spending emergency savings. Trump's agenda aims to address these economic pressures. Since taking office in January 2025, Trump has already begun implementing changes affecting Social Security Administration and healthcare programs that impact seniors. So the first idea is Social Security tax relief. No tax on Social Security. Trump has promised eliminating taxes on Social Security benefits. Currently, up to 85% of benefits are taxable for about 40% of beneficiaries, depending on their income levels. This could provide immediate tax relief for seniors, millions of seniors, allowing them to keep more of their monthly benefits. And for some, this could mean hundreds or thousands of dollars in additional income. Eliminating this could also deplete the Social Security Trust Fund much sooner, which already is projected to run out of money by 2033. So that is something that needs to be weighed in terms of what are the benefits and some of the impact that could happen by eliminating taxes on Social Security. While he promised during the campaign and reaffirmed it to a joint address of Congress, this change requires legislative action from Republican-controlled Congress. The next thing the president could do is strengthen Social Security. Without action, the Social Security Trust Fund is projected to be depleted in 2033, resulting in a 21% cut to benefits. Trump faces pressure to address this looming crisis. And then he can also improve fraud investigation, which they are already doing right now. Rather than cutting benefits or raising the retirement age, Trump has directed resources towards investigating what he described as fraud and waste within the Social Security program. And then there's DOGE. Led by Elon Musk, DOGE is targeting cost savings in federal programs. The Social Security Administration has already reduced its staffing target of 50,000 employees from 57,000, claiming 800 million in potential savings. And then there's the Benefit Protection Pledge. Despite efficiency measures, Trump has repeatedly promised the Trump administration will not cut Social Security, Medicare, or Medicaid. Balancing costs with benefit protection remains a key challenge. So, what are some of the ideas that the president can use to extend the lifespan of Social Security and ensure its solvency? Well, the first one is extending payroll tax on higher income earners. Option 1 is requiring those earning above 400,000 to pay into Social Security as proposed in the Social Security 2100 Act. Currently, only earnings below 176,000 are taxed. If you know that, Social Security taxes is at 6.2%, but it only affects those who earn up to 176,000. So the new proposal is to make sure that people who earn about 400,000 pay more Social Security taxes on earnings that are above the $400,000 limit. That is really, really important to make sure that we are keeping money coming into the Social Security system. This could generate significant revenue as high earners like Elon Musk currently pay their entire annual Social Security tax in minutes. You heard that right. The second thing is increasing payroll taxes. Raising the current 6.2% rate on employees and employers could ensure solvency. A gradual increase of 1.3% to 7.5 for both employees and employers could eliminate approximately 95% of the projected shortfall. So if all they did was this, they will eliminate 95% of the problem that the Social Security Trust Fund is facing. They could also reduce benefit. That could be very unpopular. If no action is taken before 2033, benefits could be automatically cut approximately 21% across the board. Alternatively, targeted benefit reduction for higher income retirees could help preserve full benefits for lower income seniors who rely most heavily on Social Security. Or they could also gradually raise the retirement age. Gradually increase the full retirement age beyond age 67 could reflect longer lifespans. Each year added to the retirement age reduces the program cost by 7%, but places greater burden on physically demanding occupations and could push more seniors into claiming benefits early than usual. There's more things that can be done by the president to strengthen Social Security, changing the benefit calculation formula. Modifying how initial benefits are calculated could reduce long-term costs. Using a different consumer price index would slow benefit growth by approximately 0.3% points annually, resulting in about 7% reduction in benefits over a 30-year retirement by preserving the system's solvency. They could also invest the trust fund's money in stocks. That's a bit risky. Currently, the Social Security Trust Fund is invested in special issue treasury bonds. Investing a portion in stocks could potentially generate higher returns. A 40% stock allocation could reduce the 75-year deficit by about 21%, though it would introduce market risk to retirement security. So there's a huge risk there. Means testing benefit is another option. Reducing or eliminating benefits for high-income retirees could target resources to those most in need. Reducing benefits by 10% for high-income, 25% of beneficiaries will close the 8% of the funding gap, but will fundamentally change Social Security from an earned benefit to a welfare-oriented program, which a lot of people are not going to like. And then finally, enhancing economic growth. President Trump's approach focuses on strengthening the economy through tax cuts and deregulation to support Social Security through growth rather than through direct program changes. Every 0.1% point increase in real GDP growth improves Social Security finances by 3.5% over a 75-year period. So economic growth is another way to save Social Security. Another thing the president could do is expand Medicare coverage. Trump has suggested allowing Medicare to negotiate directly with pharmaceutical companies to lower drug costs. This could potentially save seniors money on prescription medications. Healthcare uncertainty. With Trump's history of opposing the Affordable Care Act, protections for pre-existing conditions and premium subsidies that could expire in 2025 may be at risk. This could particularly affect seniors aged 50 to 64 who are not yet eligible for Medicare. So this is something that we all know about. Trump has opposed the Affordable Care Act. He tried to repeal it during his first term. So there are subsidies that help seniors pay for healthcare, Medicare, that could be in jeopardy, especially Medicaid beneficiaries that could also be impacted. So If he changes his mind, it preserves benefits for seniors. The Trump administration has previously expanded Medicare Advantage benefits, including home modifications, respite care, transportation coverage, and in home support services. Similar expansions may be pursued. And then rising cost of healthcare. That's something the president could do something about. During Trump's first few months in office, his administration ended some of the experimental drug pricing models, including the one that would have standardized $2 copay for certain generic drugs used by Medicare recipients. So that's something worth exploring. The president could also support seniors to age at home. Trump has pledged to prioritize home care benefits by shifting resources to at home care for seniors. This could help more seniors age in place rather than entering nursing facilities. The administration has promised overturning disincentives that lead to care worker shortages and supporting unpaid family caregivers through tax credits and reduced regulations. Long term care remains prohibitively expensive for many seniors, with monthly costs in assisted living facilities about 5,350 and average stays lasting 22 months at 117,700. So assisted living costs, long-term care costs is an area that the president can really help because the cost is really high and the average stay at a long-term care facility is 22 months and it costs a lot of money, as you can see on the screen. And the president can help in facility cost increases. Resident fees as independent living facilities have increased 4.4% over the past year, while nursing home and adult care costs have jumped 4.8%. These rising costs place additional burden on seniors with fixed income. Another thing is creating economic prosperity for retirement security. During President Trump's first term, the S&P 500 rose aggressively at an impressive 6.68%, despite the COVID pandemic. His pro-growth policies could similarly boost retirement accounts and investment portfolios in his second term. President Trump has made fighting inflation a top priority, recognizing how rising prices disproportionately harm seniors on fixed income. His economic plan directly addresses this crisis created by the previous administration. That is the perception out there from the reports that we've seen in polls. And so hopefully the president can address this. President Trump's economic strategy uses tariffs aimed at bringing back manufacturing to America, creating jobs and prosperity while ensuring fair trade deals that don't disadvantage American workers and retirees. So that's another way he can help support seniors. And then lower energy costs. By promoting American energy independence, President Trump's policies help reduce heating and transportation costs that take a significant portion of many seniors' budget. Another area that requires improvement is protecting seniors from DOGE cuts. In collaboration with DOGE, Trump has directed the termination of leases on approximately 2,500 federal offices, including Social Security Administration locations. This could reduce in-person service facility for seniors. The Social Security Administration is already at its lowest staffing level in 25 years and has reduced staffing further because of DOGE. The Social Security Administration is also initiating a planned significant reduction to telephone services, but has scaled back to a more limited change. Seniors may face new challenges when attempting to make account changes by phone. With reduced physical location and staff, seniors may need to rely more heavily on online services. This could represent challenges for older Americans with limited internet access or digital literacy. There are economic policies that could hurt seniors or help. Trump has implemented tariffs on Mexico and Canada. These measures may increase prices. Some economists think that, some don't. So it remains to be seen how the tariffs are going to affect seniors. And as I said before, economic policies could also increase portfolios for seniors, and fighting inflation also helps seniors, and helping reduce the cost of living for seniors is also going to be very helpful to a majority of seniors who are especially on low or fixed income. Improving Social Security is another area the president can help seniors. Cutting red tape, President Trump has directed the Social Security Administration to streamline processes, making it easier for seniors to access their benefit without unnecessary paperwork and delays. The administration is enhancing online and telephone services to provide more convenient options for seniors to manage their benefits from the comfort of their homes. Through targeted reforms, President Trump is ensuring that Social Security resources are directed towards serving beneficiaries rather than supporting a bloated bureaucracy. And President Trump has prioritized prompt implementation of the important legislation which was signed into law by President Biden, which is the Social Security Fairness Act, with retroactive payments already being issued. So if you received about $6,000 in your bank account recently, that is from the Social Security Fairness Act. And then if you are eligible next month, you are going to see increase in your monthly Social Security check for up to $1,500 for some people. Tax policies, another way president can help seniors. Trump is likely to push for extending the Trump tax cuts that were passed in 2017, which is set to expire at the end of 2025. This could maintain current tax rates and preserve the increased gift and estate tax exclusion, which is beneficial, like particularly beneficial to seniors that have wealth to pass along. Previously, Trump expressed opposition to estate tax, which currently impacts estates worth over $4.5 million. Any reduction could allow affluent seniors to pass more wealth to their children or whoever they want to pass it to. And Trump previously proposed that seniors making under $25,000 per year would pay no taxes. He also suggested that a $5,000 tax deduction for senior citizens should be implemented, which would be amazing if that is done for seniors. And then the administration has proposed accounts for dependent care that could be used for senior care with government matching contributions for low income families. So that is what is happening with the ideas that the president has in front of him to help seniors. Let's talk about critical date that is coming in a few days. March 31st is a big deadline for Medicare. 1 million plus seniors have lost benefits because benefits have been canceled. Insurers have dropped them off the plan, or hospitals have dropped Medicare Advantage plans. So knowing your current status with your Medicare plan is important. 90% of seniors are in the wrong Medicare plan because there are 24,000 plans out there, and sometimes it could be very difficult to know which one is good for you. However, it's going to cost you money if you're not in the right plan. On average, seniors spend $300,000 on Medicare during retirement for a given couple, and it's going to affect your health if you're in the wrong plan and you need help and your plan doesn't cover the thing that you need covered. So we have partnered with Chapter Medicare. The number you've been seeing on the screen, 539-205-2147, is a great resource, a free, unbiased resource that can help you within this week that is left, the small window you have to change your Medicare plan until the fall, to be able to review your plan. The minimum you can do is have them review your Medicare plan to see if you're in the right plan and it covers your needs and your budget. They can save you up to $1,100. Their agents do not work for commission, so you're not going to be put in an expensive plan because they want to get the maximum commission. Their sole mission is to help you get on a good plan. So call them or go to the description in this video and you'll see a form you can fill out, and they will reach out to you and help you. They're highly rated by the Better Business Bureau. They have amazing 5-star reviews online that you can check out for yourself. And as I mentioned, they can save you money. But the time to do this is closing before, once this shuts down on May 31st, once we get to this window, after the end of this month, you cannot make any change to your Medicare plan until the fall, October the 7th, or October the 15th, I believe, to December 7th. So this is your window to get a change done quickly before the window closes. At minimum, have them review your plan to make sure that you are in the right plan. Call the number on your screen. And that is all I have for you today. So until I see you on my daily live videos, Thank you for watching.